I'll tell you the truth,
Yeah.
right? Kenya has one of the most progressive policies around digital health. They understand the core of digital health.
Yeah.
And they've been engaging, okay? One of the first things when I saw that I liked is the fact that to do a telehealth company, you needed to be a level 2 hospital. I think that made sense because at some point, somebody needs to have some level of responsibility. I think the engagement around the digital superhighway in terms of data interoperability, these things, conversations ongoing, are very important conversations.
And then, depending on the method you use, the patient could be skeptical of the result. Think about you doing a HIV test and sending it on text message that you are HIV positive. You can be sued for that. That is negligence. So there are proper ways to deliver the information. Again, the doctors have, as much as we are using telehealth, there is a level of assessment that this now requires a physical consultation for us to have a one-on-one talk and understand these things. So the issues of resistance, it's a matter of awareness and explaining things for the patients to understand.
Yeah.
But the biggest resistance is not in terms of those policies. It's in terms of
The patient.
Antony's colleagues
It's the doctors.
who believe
Yes.
that telemedicine is here to replace them, right? There are medical practitioners
Yeah.
who do not believe that digital calendars should schedule their appointments, right? They are old school.
The old school. They want a physical.
They want a physical this. They don't believe in a lot of these things around digital health. And it's understood that we need to keep engaging, right? Those are people that we need to win over because health is a trust-based issue. And one of the things that you would end up understanding is that the average person wants to be touched, wants a doctor to touch and feel.
Welcome to the Med Squad podcast. My name is Yafesi Musoke, and we get it. You're busy. You are really, really, really busy. And so sometimes you don't even have time to actually take care of yourself. So what do? You go online or you make a call. Let's talk to the people who actually will be on the other side of that call. We're talking about telemedicine, and I have experts right here next to me. We'll start from this side. So introduce yourself.
So thank you, Ifeso, for having me here. Welcome, everyone. I'm Dr. Antony Ndegwa, a General Medical Practitioner.
All right. Welcome. And
My name is Ikechukwu Anoke. What am I again? I'm an entrepreneur, I'm an innovator,
yes,
and I sit on the other side.
you sit on the other side. Yes. Now, in fact, we're actually going to talk about that because it's when I hear the word telemedicine, I'm thinking, of course, I mentioned the word phone because of, like telemarketing and tele. But what is telemedicine exactly?
Well, you see, telemedicine is I would define it as the act of leveraging a mobile device to seek access to health.
Yes.
So either by calling a doctor on the phone or using, smarter tools today in terms of AI, whatever, to be able to access health.
Yeah.
But it's important to look at telemedicine. That telemedicine is not just a concept of today.
Yeah.
Telemedicine has always existed.
Always.
Yes.
Okay.
Because think of all the times you picked up a phone and called your cousin who is a nurse to say, I have a pain in my stomach.
Yes.
And she says, why don't you go and take this medication? Or the time that you've called a doctor friend to say, hi, I'm having this challenge, and the person walks through your symptoms over the phone and says, why don't you buy this medication over the counter?
Yeah.
And it has become very important today because of COVID that we've brought it mainstream to look at it from a point of, this is really an important part of healthcare. And with the advances in artificial intelligence, machine learning, people are beginning to say, okay, telemedicine as a concept, we need to look at it.
Uh-huh. So now so what I'm getting is telemedicine is kind of the formalization of what we used to do to our relatives when we ambushed them at events.
Yes.
Okay, so then how do you structure it? What are the key aspects of telemedicine for it to be officially called telemedicine?
Okay, thank you. So as he has said about, it is something that has been evolving, it has been there. think of the most rudimental forms as those as in the 20th century, we could see people talk to a doctor on radio. So the doctor was on radio and you could call and tell your symptoms and they could explain some of these things. So that's a form of telehealth. However, the modern telemedicine keeps on evolving as we evolve in information technology.
Yeah.
Okay. So as at now, with the rise of AI, if you go a step back, you realize that the phone calls, the cellular phone calls, the messaging, the websites, the chatbots, and all things, they're all the forms that we use. However, when you look at them critically, it's just offering these clinical services or healthcare services remotely.
Yeah.
The traditional way is you work physically, but this one, you can still get these services, although there are some limitations to it, but there is a better, there are more important or more advantages that come with it as compared to the traditional way. So it is not like we are saying, drop this one, we are merging them together so that we can have more access at a cheaper price. And that is what we're saying, it is revolutionary. So there are other words that can be used for telemedicine. You'll hear telehealth, e-health, cyber medicine. All these terminologies have been coined to reflect on this technology that we're going on with. So it's something that is revolutionary and it cuts across so many diseases. We're going to talk about them step by step as well.
Okay. So now, obviously, because we are very mischievous customers, what is the difference between this and Dr. Google? Because I will go and get my information, I'll just search and do this, or as opposed to speaking either with a chatbot or even going onto a platform where it's face-to-face with a real doctor. So what is the difference?
Well, I think I'll start by saying there's a difference between telehealth and digital health.
Okay. Telehealth and digital health. All right.
Yeah. Because, when you unpack digital health, it encompasses different solutions, web, different sorts of technologies that are emerging today that is, reducing the dependence on physical doctors, but telehealth revolves around your mobile.
Okay.
Right? Yes. So it's important to look at because there are elements of, digital health that is not, we'll call smart and non-smart. Text message.
Yes.
Text message is a non-smart form of being able to chat with a doctor on text. Yeah. It's a basic form. But today we can look at RPPG, which is face recognition, leveraging that to be able to, diagnose, screen for your HbA1c, etc. That is a more, say, smarter tech.
Yeah.
Okay. Back to the question you asked, which is the difference between this and Dr. Google. Well, you see, not very much.
Not very much.
Right?
Yeah.
But one of the things that this conversation today around telehealth, trying to build a framework around it, is supposed to put a distinction. So I have a challenge and I go online and I say my stomach hurts. We're going to see everything.
Yes.
Cancer, there's different things that mimic most of those symptoms, right?
Yeah.
That's all you're going to see, right? When you look at telehealth, the way it's designed, there are steps of triaging that will help narrow the symptoms, questions that are going to be asked to help pinpoint you towards a treatment plan. So telehealth puts some method to the madness of a huge world of information in Dr. Google.
So it brings laser focus.
Yeah. Yes. So on the same, just to add on, just put it in context. When you Google, you get all the websites, all the answers. Even when you use, let's say, online large language models, that go online, they're still going to bring you the opinions, non-credible information. And from a layman's point of view, you might not be able, who is speaking, the credibility of the source.
Yes.
That is different from telemedicine. Because even away from a practitioner-based telemedicine, where you're speaking to a specific doctor, even when you think about the models that are used, the AI that are used, in artificial intelligence that are used for telehealth, they are taught, or they learn on the context of medicine, and they have limitation onto what they can prescribe. So for safety of the patient, so there are limitations to which they are not there to replace the clinical acumen of the doctors. They are just to help. So, for example, if you ask 2 questions, 3 questions, and the model thinks you're having pneumonia, it cannot prescribe. There has to be a doctor to make sure that everything is within context, okay? So, Dr. Google, first, that is not something I'd recommend, because there are so many misinformation, disinformation on Google. That is different.
Okay, so the verification process and also like a second opinion, that is kind of built in. So the question would be, can these telehealth either platforms or solutions, can they be independent, or do they have to be embedded in a recognized institution?
Well, I think for a regulated, field like medicine, very important that this is embedded in institutions that that's essentially is there needs to be a process of accountability.
Yes.
Okay, so essentially, if I come and I'm speaking to this telehealth platform, I need to know that this telehealth platform exists somewhere.
Yeah.
That there are people who are to be held responsible. So even when you go to a doctor and the doctor misdiagnoses you, somebody takes responsibility. You know who to hold responsible for that action.
Yes.
So it's important that in the process of telehealth, building telehealth or having telehealth framework, that it is embedded in recognized institutions, having people that are responsible for them. So even, for example, Google, the world's largest search engine, they built MedPound, which is their own telehealth platform.
Yeah.
And you know that if you're MedPound and you are having conversations in there, that you would hold Google responsible should something,
Yeah.
So these things are very important.
What percentage of hospitals have embedded
Okay.
medicine?
Just to add on that, even with the platforms being attached to existing medical organizations, there is still not a well laid out policy in terms of regulatory aspect with different government. Talking, for example, Kenya, on the scope of what can really be done with telehealth. Okay, so it is a business in progress, trying to reshape, know that this is what you can do, this is what you cannot do. Is there a possibility for telehealth to just exist online and they have no physical offices? And also, I think it's something that is going on progress, even with more established nations like the Western nations. So there is need to also continue having discussions around that. Okay. So, however, on the statistics around how many hospitals, I would say that I personally have seen any conclusive statistics on how many hospitals have them, because there are so many startups about telehealth, even personal boats on people on tech, just having those. So the statistic for that is neither here nor there. And there's
I'll say that almost every modern hospital has some level of telehealth.
Okay.
Because, for example, in Kenya, there's a 109 mobile penetration rate.
Yeah.
Every household has a mobile phone. Every organization has a line.
Yeah.
And somehow, health. So I would say that almost every facility has an element of telehealth.
Yes.
Right? It depends on the scope. It depends on the use. It depends on how it's consumed. So, for example, think of it in a nurse is on duty and a patient is having a crisis, right? The doctor doesn't necessarily need to fly and come down to that place. She calls and says, Daktari, there's a problem here. On the phone, what's going on? Tell me, what are the vitals? Have you checked this? Have you checked this? Put him on this, put him on that. That's telehealth.
Yeah.
Right? That exists.
Yes.
Currently. So as in unpacking telehealth, we now begin to unpack the more independent, or I say more fancy stuff that is going around telehealth, and how that sometimes brings friction between medical practitioners
Yes.
and innovators.
So tech
Innovators.
Yes.
In terms of how can we push the boundaries
Yeah.
of health
Okay.
using digital health, or
So-
telehealth.
So do things like when you're talking about futuristic surgery, remote surgery, where someone is giving instructions to people, does that count in telemedicine?
Yeah, so from a doctor's point of view, there are limitations. That one we can agree that even with the advances in technology, there are things we've not yet found out. Let's say we don't know how to do it with telemedicine.
Yes.
We are not saying it can't be done, because even earlier we did not know you could know your temperature just by a laser, okay? You had to do the contact, even do the rectal ones and all those things, okay?
Yeah.
But today, with non-contact, you can still get your temperature. So there is hope in advances. But as at now, there are things we know we cannot do. For example, surgeries cannot be done remotely. Not that I know of.
Even with robotics or...
That is not remote because
That
the
is not
patient is
remote.
there.
Okay.
Okay, the endoscopes, the patient is there and not like the patient is away. So we are saying telemedicine or telehealth is all about offering clinical services remotely. It's an issue of distance.
Yes.
Okay.
Okay.
So when the patient is there, then that is not telemed.
Oh,
That's interesting.
I think that surgeries can be done remotely. I think that when a patient is in a hospital and you need a brain surgeon, and when you look at the brain surgeon to patient ratio,
Yeah.
there could be just one brain surgeon to
Several thousand.
several thousands of patients, and the brain surgeon who is in, I don't know,
Korea.
in Korea can guide a robotic hand in Nairobi to prepare to do a brain surgery.
Yeah.
I think that we need to open up to the possibilities of this, because essentially, in underdeveloped countries, I'll say the global south, that our reality
Yeah.
is digital health. Because without digital health, you are done.
Yeah.
Right? It's a fact.
Yeah.
We're not producing enough specialists, doctors. We do not have the resources or the infrastructure. And like I always say, if you took all the monies and said, government don't focus on anything, all our resources are invested in health, it is inadequate to be able to build the sort of infrastructures that we need. So we now begin to ask ourselves, how do we fix the problems we have, taking advantage of digital health?
All right. Well, we're going to take a break right now. And when we come back, we'll look a bit closer at the challenges we have, but we're also bringing it home so that it doesn't sound so techy. It comes directly to you, which is what telemedicine does. You're right here on the Med Squad podcast. Hey there. Welcome to Zuri Health HQ, where Africa's finest medical minds meet modern care. I'm Yafesi, your host on the Med Squad.
Care is personal. It's not just diagnosis, it's direction. From a cough to managing chronic illness, we listen and we lead.
Every symptom has a story. We listen, explain, and act together.
Nutrition is not just about food. It's fuel, it's healing, it's prevention. We help you eat with purpose, for energy, for recovery, and for lifelong health.
We are not just lab coats, we are detectives, and your blood speaks and it translates.
Your mental health is not a luxury, it's your health, period. Whether it's trauma, depression, anxiety, or even wanting to speak to someone, we are here for you.
At Zuri Health, collaboration is our strongest prescription. We connect expertise across Africa to deliver care that is smart, affordable, and people first.
This is the Med Squad. Real conversations, real health, real people. From your inbox to your bedside, we're with you. Welcome back to the Med Squad podcast. Yes, I am coming to you via a screen. And maybe there's a doctor who wants to come to you via a screen. Let's give them a chance. But there are challenges with that. So, what are the limitations that are, I'd say, unique to telemedicine? There are challenges that are general in the healthcare sector, but the ones that are unique to telemedicine. What are those challenges?
So we're saying that the scope is still limited on what you can do. So think of more clinical cases, let's think of mental health. Telehealth works best. In fact, it's been shown to be even better than people walking into a facility the conventional way. However, think of things to do with wounds, surgeries, all these things they need for physical patients. Okay, we are thinking of examination. So any condition that requires the doctors to examine you, we can use pictures, video calls. They do, but they still have a limitation because when you're examining, for example, let's say you're examining a mass, maybe somebody has a swelling. There is an aspect of palpation. You have to touch, and it's very important. Can differentiate between. Let me give you an example of one of the most controversial things that is done for examination or screening of prostate cancer. It's called digital examination, DRE.
DRE.
Yeah.
By digital, you're talking about the digit.
Yeah.
This one.
So they point you in the right direction.
Yes.
Okay. So the doctor, if you compare digital rectal examination and the PSA itself, a lab test, then the digital rectal examination is a better test than the prostate-specific antigen that we do in the lab.
Yeah.
So you see, in such cases, you need to walk to a hospital. Okay. However, there's so many other good things that telehealth can have for you.
Yes, including not having the digits. Anyway, so the thing is, telemedicine in general, it's disruptive. So when you mentioned the government and even if we plow all the resources, there's no way physically we're able to have the infrastructure. But is there resistance in either whether globally or on the continent to now the influx of telemedicine organizations or platforms?
As in any industry, disruptions will always meet resistance.
Yeah.
Understood?
Yes.
I'll give you an example. Do you know, this M-Pesa, the M-Pesa phenomenon, the world's best mobile money transfer? You know that it was 4 times resisted here.
Yes.
And its success here in Nigeria, they made sure that it never saw the light of day. The banks came together and said, we must never allow this work. Now, and this is always, the same thing you will see in every industry, right? So today in health, yes, there are a lot of challenges, friction between regulators, between policymakers, and between innovators in terms of what can be done. I think these are healthy things to happen. And I think it will require much more engagement to be able to unpack. Because essentially, one thing is important. There needs to be some governance framework or regulation around the practice of digital health, telemedicine, whatever. There are questions around ethics, questions around healthcare data, where it sits, where it goes to, questions around the clinical research done around it. When I am looking at using AI in the US, looking at skin tone, skin color of a Caucasian person, is it adapted to my skin color of an African person, right? These things are things that we need to look at broadly in terms of coming up with solutions or a proper framework around digital health.
And is there that support, or is there a willingness to reach out and partner, or do you have to, you're in pitch meetings all year?
I'll tell you the truth, right? Kenya has one of the most progressive policies around digital health, right? They understand the core of digital health. And they've been engaging, okay? One of the first things when I saw that I liked is the fact that to do a telehealth company, you needed to be a level 2 hospital. I think that made sense because at some point, somebody needs to have some level of responsibility. I think the engagement around the digital superhighway in terms of data interoperability, these things, conversations ongoing, are very important conversations. But the biggest resistance is not in terms of those policies. In terms of
the patient.
Antony's colleagues.
It's the doctors.
Who believe that telemedicine is here to replace them. Right? There are medical practitioners who do not believe that digital calendars should schedule their appointments. Right? They are old school.
They're old school. They want a physical.
They want a physical this. They don't believe in a lot of these things around digital health. And it's understood that we need to keep engaging. Right? Those are people that we need to win over because health is a trust-based issue. And one of the things that you would end up understanding is that the average person wants to be touched, wants a doctor to touch and feel. So how do we build that trust? How do we try to convince you that some of the things that you're used to, walking into a facility, having a doctor do this, that technology can help you do it?
Yeah.
Right? So to do that, I need an ally in these doctors who they've trusted for so long to begin to say, yes, you don't really need to come to me, use this, right? So it's a very important, so that's where the biggest bottleneck is. And I feel that if we're able to get them to understand that digital health is not here to replace you.
Yes.
AI is not here to replace you. AI has to support you. Then we can begin to have some.
So we're not being replaced by AI. We're being replaced by people who know how to use the AI.
Yes.
So the question is, the patient, the ones who like especially physical contact, sometimes they've had the same doctor for 10, 15 years. And so in their minds, some of the doctors they deal with are older doctors. But the ones who would be adopting or accepting the platform tend to be either younger or more tech-savvy doctors. And then now comes the trust issue of, there are people like in rural areas who don't want young doctors. So how do you get around that?
Okay. What has been said is very true, that our older colleagues don't want to appreciate that it's a new dawn. However, I am a strong believer that health industry and other industries, they are living. So they have to continue growing. Okay. So even from my practice, there are doctors who will tell you don't need an ultrasound. Just touch the patient, use the tape measure, do all these things, and it's good. But we have to realize that even with technology, you have to see some patients physically. Okay? It has even with the follow-up, sometimes they need to walk in for that personal, which cannot be replaced. Okay? So for them, I know it's a learning curve. They will catch up, but the more doctors we're getting today, I think even in the medical industry, the training, I think we will continue to implement these things. And even from the training, doctors will come understanding that it's not all about touching the patient, looking at the patient. You can still help them remotely. And even with the bottlenecks, all doctors will agree. Let me give you an example. One of the counties in Kenya, Turkana County, the distance between hospital to hospital is averagely between 50 and 30 kilometers apart. Okay? Again, it's the WHO recommendation of around 5 kilometers between hospitals. So think of a woman who wants to go for ANC clinic. They are pregnant. There are no roads. In fact, Turkana is almost the size of Rwanda and Burundi. It's
massive.
Okay, so it's massive.
And it's hot.
So, but those people today, they can get these services at the comfort of their homes with a phone call, leave alone going to the internet. And the telecommunication sector is expansive. Today, the network coverage increases. With the network, if you look at the health access, we are looking at, give or take, 72% of healthcare, the Kenyan population not able to access basic care. Consultation to a doctor, dressing a wound, tetanus injection, getting the information that nutritionally this is how you're supposed to eat, things that are so basic, things that I will call so old things for us to exist. This is the only platform that gives us that basis to be able to disseminate this information and get health there so accessible and also affordable.
So sometimes I'm going to look at it from 3 steps. So the first one is we talked about the older colleagues and talked about how can we get them on board. That's now where we need a government. Because regardless of what you say, when it comes to matters health, the person with the biggest credibility is the government. Now the government standing behind telehealth gives it a level of credibility, right? Because think of immunization, think of when the government comes and says, this is allowed, do this, it puts some force behind it and people begin to onboard. But let's look at telehealth and digital health and all the things it enables. Because telehealth is not just the fact that I'm here and I'm talking to a doctor. It's the fact that home is the new hospital and that your mobile is the new hospital. That, he mentioned the distance, doctor to, distance between hospital to patient. Let me now give you a doctor to patient ratio. Doctor to patient ratio in Africa is 1 doctor to 10,000 people, right? Against the recommended of 1 doctor to 600 people. But also in some countries is 1 doctor to 25,000 people, right?
Yes.
So think of it for a second. That there are areas today, Dr. Antony, if I offered him a posting in Turkana to be a doctor, he'll say, no, I want to be a content blogger in Nairobi. He won't go. Not because he doesn't want to serve. It's because the infrastructure, the lack of infrastructure, the lack of access will make his quality of life difficult that he would not want to be there. So are we saying that patients in YG do not deserve healthcare? They do.
They deserve it, yeah.
But guess what? What telemedicine does is that it provides an access for people, because when you come and you hear that in Nairobi, there are doctors without jobs,
Yes.
that in an area of concentration, those people can provide access to health to people where you do not have access to doctors. That is one enablement of dealing with the issue of demand. I'll go to the second one, which is very important because telehealth enables. It's not just I want to talk to a doctor. I want to have a doctor come and see me at home. I want somebody come and pick up my lab tests. Right? I'll give you an example. I was in the UK a few days ago, and I wanted to do a lab test. And I walked into the hospital, and I was told that the wait time for me to see a nurse was 5 hours.
Wow.
That's the wait time from registration for me to see a nurse. I went to the accident and emergency, was 5 hours. And it was full. Right? And that some people, that for me to get some tests done, that the wait time is 8 months.
In the UK?
Yes.
The one that's lauded worldwide.
8 months.
Okay.
Now, let me walk you back. One of the things that the health can be is that I can, at the comfort of my home, ask for somebody to come and take my test. That the way that in my need to access health, that it will not disrupt me from my normal economic activities. So just think of having to go to the hospital and spend one whole day to be able to be seen, that it's something I'm able to do from the comfort of my home. But I'll tell you something also very important. That 45% of those who go to the hospital don't need to be at the hospital.
Yes. Okay.
So I have 1,000 people at Kenyatta Hospital waiting to see doctors. But 100 people are in dire need to see any doctor. A lot of the people who are there don't need to be there, right? That they could access health from where they are, right? And these are the things that telemedicine enables. But it is not just digital health. It's the ability. Think of this community in Turkana, a pregnant woman who can't go the distance between where she is and the nearest hospital. But the mobile ultrasound can go to her home. Right? These are part of the things that health, digital health enables. So broadly speaking, that the benefits of digital health is not just in the fact that, I'm talking to a doctor on the phone. Is the other things that it enables around access, affordability, and I think we can, deep dive into that later.
Okay. Yafesi, just on the same, diving into the issues of absenteeism and how health affect the financial aspect of the work or the corporate industry, we've realized that studies have shown that on average, people with chronic conditions, they miss between 2.6 days per month just for their healthy needs. They walk to a hospital. But as he has said, there are some of them who do not need to be in a hospital. In fact, being in the hospital is a health risk for them. Okay? Think of somebody with hypertension who just went there to take their medication. They can come there from the hospital with a nosocomial infection. So think of those people, they don't need to be in the hospital. So there are some myths that are around telehealth that people think that physical appointments are superior. No, studies have not shown the same. In fact, it's even superior in terms of medical health. So telehealth is more superior for mental health and chronic conditions, the follow-up. Okay? The other thing is, some people might think overall it's expensive. No. In fact, in terms of access, you're looking at availability and affordability, of which telehealth offers both. Okay? The other aspect is it is for the young people. And that's why even the young doctors are being accused of you want to use the older tactics. No. Even the older population, as long as you have some level of literacy, you can get help from telehealth.
Anyone can get help from telehealth. Now, we're going to go into details about, well, not just telehealth and getting a bit more personal with that, but what about the future and the growth and the issue of COVID-19 right here on the Med Squad podcast? Welcome back to the Med Squad podcast. I called my doctor and he said, "Can you be serious? You're in the middle of a podcast." Okay, fine. I'll get him later. Now, the way we've discussed it so far, this looks like telemedicine it can even change culture. So attitudes towards healthcare and even personal responsibility, attitudes can change through telemedicine. The question is, would we have even got to this level if it wasn't for the pandemic?
No. I'll tell you, if there was any blessing telehealth got, it was COVID. Right? COVID-19 was what accelerated the conversations around telehealth. It exposed the underbelly of healthcare in Africa, how unprepared and broken we were. But also, I will give you my life story. Okay?
Yes.
I came back from the UK. I had some work to do. I came back in April. At the point I was coming back, COVID had, broken at everybody. The whole world was,
down. Yes.
And I came back unwell. I had all our CBT and I was struggling to breathe.
Yeah.
And I said I needed to go to the hospital. My wife said, which hospital? Right? My wife's a doctor. She said, which hospital? Well, everybody is, if you don't have any. So she said, no, I'm going to call someone to come and take your vitals. So she called somebody at a hospital just down where we live, fellow doctor, and he came to the house. He took my stool, urine, and blood sample. The first thing I asked her was, this is possible, right? She said, what's the difference? Right? I knew that this was possible, but I did not know that, it didn't hit me. I was obvious. Why? Because at that point, I was really building Zuri Health and I was building a doctor booking app. In fact, the original concept of Zuri Health was an app where you're going to look for specialists, book an appointment to go and see a specialist. Right? So guess what? You take the samples to the hospital. He came back and said, there is in your urine plus. Glucose in your urine. So my wife says, okay, cool. Can you do his HbA1c? We want to check. And we did my HbA1c, 10.8. I was diabetic. Right?
Yeah.
So I sat down, and at that point, when you switch on the TV, anybody who's died of COVID, hypertensive or diabetic, I said, I'm dead. Right? I said, madam, you can remarry. The children, these are the plans for them. Because, man, this is done, right?
Yeah.
And I went online and I Googled, I am looking for a diabetologist. I saw a name, Dr. Gaman Mohammed. That's my doctor. And I called him. And I said, Dr. Gaman, this is my condition. This is this. He said, okay, this is my number. Send me the results on WhatsApp. And I sent him all my results on WhatsApp. Then he sent me additional tests that he wanted me to do. And we called the same place and they came and picked those samples and did those tests and sent to him the results. Said, okay, I need you to buy this glucose monitor. And he sent me a picture that he wanted me to check my sugars whatever, and sent me a prescription.
Yes.
I called a pharmacy
Yes.
to deliver those things.
Yes.
And every day, as I would check my sugar, I will send him the results on WhatsApp.
Yes.
3 months later, my HbA1c was 4.8. That was the first time I saw him physically. I had started my diabetes journey and put it in control and reversal
Yeah.
in 3 months without stepping my foot
In
in a hospital.
Yeah.
And that was the point I said, no, this is what Zuri Health is going to be. Zuri Health is going to be a place where you can stand and end your healthcare journey in one place.
Yes.
But it took me a personal health crisis,
Yeah.
right, to see what was obvious, because people have been taking samples. I just remember I would say, oh, you can go to the hospital, I can't get this 2 sample. They'll give you the container. Go home, when you get this 2 sample, bring it to the hospital.
Yeah.
So why couldn't we get it? You know, so what was so obvious,
Yeah.
Telehealth put it together from my mobile phone.
Okay. Now, this, in terms of the potential, it's pretty obvious. But now here comes the obvious question. You're receiving samples as a doctor. You've requested this test. You've requested that. Is there a measure of trust or resistance from people? Because it's one thing to take my blood sample or stool sample, and it's another thing to hand it over to a courier or to someone else and send it across the city. Have you received resistance in that sense? Do people have these fears regarding telehealth?
Yes, and that's one of the challenges that telehealth faces. However, before I address that question, just on the personal experience with telehealth, one thing that is very concerning is that almost 80% of people who seek medical help or who seek medical help for mental health problems,
Yes.
they commit suicide. So, majority of people who commit suicide, at one point, they were in contact with a therapist or a medical practitioner, not necessarily a therapist, maybe a nurse or a doctor,
Wow. Okay.
but they still went ahead and did the deed.
Yeah.
The other aspect is when somebody goes to the hospital and they were just maybe going for a checkup and they find the environment sometimes it's not conducive for somebody to feel better.
Yeah.
You just see somebody amputated and you go home thinking, that's worse off. But you've not solved the problem. You just felt that you're better off, but you're still not okay.
Yeah.
And this hits men more. So the healthy seeking behavior of specifically men is lower.
Yeah.
And telehealth is very important because I've seen with my limited years of practice, I've seen that we can now see more men behind screens and keyboards talking about their problems, talking about sexual dysfunction, talking about the battles they have in marriage, which is very difficult for you to see a man, a full-grown man who walks into a hospital, and to even find a younger doctor like Antony. They feel like you cannot understand
issues,
my mental problems, financial problems. You're still young. But with that anonymity, you can speak to somebody in Wajir, you don't know if they're amputated or not. They tell you what they want, and you can offer them mental health services. So I think that's one of the most revolutionary things I think that telehealth does. So coming to your question about resistance from the client point of view, even me as a doctor, I will have fears with whoever is handling me. I have to feel comfortable. Normally, when you walk to a hospital, there is something called implied consent. That you walk into that consultation, you've already accepted that this doctor can look at your details. You tell them your problem, your private, your inner self. However, with telehealth, there are privacy issues. That you've taken my blood, yes. Leave alone the issues of how you transport it and the integrity of the results. I am not there to wait and see. It's so different.
Yes.
But I think it's an issue of education and awareness that as long as the mode of transport does not change the credibility of the results, we're talking cold chain and all those things, you'll still get credible results. The delivery of those results is the other thing.
Yes.
You see, some tests, they are higher, low, normal, negative. There is the background information the patient should be given for them to be interpreted. That is why it is not proper for a doctor to do a test and just send it to the patient. So there are follow-up calls.
Yes.
For example, if you're thinking you've done maybe a prostate cancer screening test and it's positive,
Yes.
you just don't send it, even a HIV. You just don't send it. You have to call, prepare the patient, talk to the patient, and then deliver. So there are those kind of things. And then depending on the method you use, the patient could be skeptical of the results.
Yes.
Think about you doing a HIV test and sending it on text message that you are HIV positive. You can be sued for that.
You can,
It is that is negligence. So there are proper ways to deliver the information. Again, the doctors have, as much as we are using telehealth, there is a level of assessment that this now requires a physical consultation for us to have a one-on-one talk and understand these things. So the issues of resistance, it's a matter of awareness and explaining things for the patients to understand.
So again, I think it's also important to mention that, some of the challenges that you're going to see today around telehealth and the issues of quality concerns that are expected in an emerging, field, emerging practice, and we'll keep, fixing them, building as we encounter, different ideas or processes. So I like the very important example that you mentioned around mental health, and how important, right, telehealth, the anonymity feature is. Talk about women's health. Talk about, due to community and social norms, the young girl walking into a clinic to say, I want to know about safe sex. They will sit you down and say, who's your mother? Where's your mother? Give me your number. Doesn't she attend the same church with me? But you can, from the comfort of your privacy, ask such questions and get valuable answers, because this is very important. But also that we're moving away from the chemist culture that we have in Africa.
Yes.
Africa has a chemist culture. What is a chemist culture? I am not feeling well. I walk into a chemist.
Yes.
Doctor, I have stomach problem. Of pharmacist, I have a stomach problem. Okay, take this medication.
Yeah.
Right? That is a challenge. And the reason why is because I'm thinking the cost of me going to see a doctor, the time it will take for me to go and see a doctor. These pharmacists, they know they sell this medication all the time. They've seen so many requests they can, and that's wrong. So one of the things digital health is doing is helping remove those barriers to make it easier. And when you've spoken to a medical personnel, a doctor, a clinical officer, that by the time you're going for a prescription, there is a background, right? And these things are, very important.
Yeah.
Yes, just to add on the same, and how, when you look critically at telehealth, if I asked you a question, we know that the leading cause of death in Africa, or even in Kenya, is non-communicable diseases. We've gone away from the infectious diseases, the diarrhea, all those.
Yeah.
Almost 40%, right? What is the common, what are the causes of these problems?
Lifestyle.
Okay. Yes. Which is not a single solitary thing. It's not a bacteria that we know, that we can test in the lab. So it means prevention is the only solution we have. So prevention is the only cure. Not even is better than cure. It is the only cure we have. Okay. How do you prevent against an enemy you don't know? So it comes, the aspect of education comes in. How many times have you gone to a hospital to just ask daktari, what is, for example, the commonest cause is, the commonest written medication is PPIs, omeprazoles and abravas, for issues of acidity. Okay? How many times have you gone? You've been suffering from this condition, but you said, now today, that I am feeling okay, let me walk to the hospital and pay consultation. Sit down with a doctor and tell them to explain to me what this is. That I was born with the acid, but today is a problem.
Yeah.
90 out of 100 times, when you go to the hospital, you'll come with a prescription.
Whether or not.
And we know that is not the solution.
Yeah.
Okay? Telehealth offers us one very great tool for education.
Yes.
That you're able to learn how to prevent against this disease or that disease every single day.
Every single day.
Okay?
Which now becomes lifestyle change.
Yes, the same way we learn about religion with the Bible. It tells you, oh, today you were supposed to read Ephesians 1:2. You see, we have wearables that are telling us today, if not hydrated.
Yes.
the maximum amount of walking today is deficient, is inefficient. Like, you get the point. So it is giving us a very preventative approach to these diseases. And overall, as we continue to inculcate more information to these models, we will get there.
You know, I just want to say one very important thing.
Yeah.
I think we've talked a lot about telehealth and, you know, very little around artificial intelligence. Africa will leapfrog the age of AI. Why? The need here, where you have the biggest problems, that's where it's a fertile ground for innovation. The need is more. Number two, that because the need is more, we're not bogged down by overregulation, bogged down by excessive policies. I call them, you know, strangulation by regulation, which is one of the challenges around innovation. Doesn't mean that we're dumping ground for every technology. No. The third is that because we don't have the money, we can't afford it, health, that this will help in terms of reducing the cost of access to health. I'll give you an example. Today, if you want to do your liver function, kidney function, HbA1c, full wellness test and all that, the cheapest will be about $80. Okay. Without insurance. It's important to know that we have a 3% insurance penetration rate. Right? 3%. Now, but people have been building, leveraging on RPPG technology, face recognition, to do the screenings. Right? And we'll say we want to retail it for $1. So in Kenya shillings, for example, for something that will cost about 10,000 shillings, somebody would pay 120 shillings to be able to get those results. These are one of the things that, so that, you know, can help make healthcare super affordable. And these things are super important. I'll give you another example. What is the radiologist to patient ratio?
That one I didn't even know. That's even, it's a little much lower than the doctor.
So, imagine being in the outskirts of Sokoto in Nigeria, and I am doing scans. How do I get a radiologist to interpret it? How many radiologists will I find in Sokoto that will sit to interpret it? Using AI can help interpret multiple results, but enable the opportunity, even if you're not trying to use AI to interpret it, but that you could send the films to somebody who could be in India or the US or the UK to be able to interpret those results and send them back to you. This makes it affordable to be able to access health. We do a lot of medical camps, and we go to different communities. Now, imagine taking an oncologist and taking the oncologist from Nairobi, taking an oncologist to Kisumu to go and spend, maybe Kisumu is fine, taking to Mandera to go for 3 days to talk to cancer patients. How much do you think you're going to pay the oncologist to leave their practice in Nairobi? How much do you think?
The rate card.
What does it mean? Imagine the opportunities and the possibilities of having oncologists in Nairobi working, doing their normal things, but have an opportunity to review cases in Mandera. Digital health, the artificial intelligence, digital health will help. There's a lot of things that will help them. So precision medicine, building, helping us drug discovery,
access to specialists.
Access to specialists. It will be the thing that will save us for healthcare in Africa. And I'm being brutally honest. That policymakers today need to begin to call innovators from all over the world to say, come to Africa and let's build a hub for artificial intelligence in health. Because our needs are dire. We do not have the money. We do not have the specialists. that if we want to talk about preventative healthcare, which is the foundation of, communicable diseases and all, that the fact that I have a mobile phone that I can screen,
Yes.
right?
Yes.
And I know my sugars, liver function, kidney functions, etc. And I don't need to spend a lot of money to go to the hospital to do these tests. And I can forward that to my doctor, and my doctor can see.
Yeah.
Or and advise me on next steps. Or my mom, I can monitor my mom's hypertension all the way in Enugu, and I'm here in Nairobi. I can monitor her hypertension and know and send the information to the doctor.
Yeah.
Right?
Yes.
And this can help create, a process for continuity of care.
Yeah.
Well, let me give you one very important thing that blew my mind recently. When I sit down with Dr. Antony and I'm saying I am not feeling well, how long do you think Dr. Antony has to talk to me and listen to all the pains I have in my back, my knee, my joint, my head, how all the symptoms connect? How long do you think?
Not with that
With the
ratio.
queue, with the queue,
With the queue.
I queue outside.
And if he likes me a lot and likes my colorful jacket,
Yeah.
maybe 1 hour. Maybe 2 hours if he's a relative.
Yeah, that's too much.
Maybe
That's too much.
3 hours if he's a very good friend.
Right?
Right, I'm married to one.
With the
I'm
queue?
married to a doctor, and I sometimes she just put on her headphone and say, "Dude, you're asking too much questions. I want to do something else."
Yes.
The idea that with artificial intelligence, I can put all the information I have in one place, and it can map out my health journey, and a doctor can have time to look at that summary to say, "You did your test on this day. This were the numbers.
Yeah.
You repeated it 3 months ago. These are the numbers," right? You have complained about this. This is how it correlates to your symptoms. It's easier for Antony to sit down and in 15 minutes go through a health history of 4 hours, 4 months
Yeah.
together in one place.
Yeah.
That is the power of what AI can do. So imagine that same Antony who's talking to me. How long do you think it will take for Antony to dictate all the things that I'm saying?
It'll take away.
How long do you think it will take to write? And if Antony has to listen to me for 4 hours and write everything he has, how many people will Antony be able to see?
Yeah.
AI will help Antony do his, triaging, dictates, and medical reports seamlessly loaded. And that the next person reviewing it can be able to go through that history. So many things that the age of AI will herald for access to health, better healthcare management on the continent.
So on the AI,
Yes.
initial studies have shown that a study or a test between AI and physicians in terms of clinical judgment, that you go to an AI, say you have cough, difficulty in breathing, fever, and all those things. And the clinical diagnosis they make, the service those of physician have been shown to be the same.
They're the same.
In fact, AI beats them in some cases.
You get it?
It's faster.
Yeah, so there's a lot of light that we are getting there. It's on an issue of efficacy, so that we know this AI cannot hallucinate. It's an issue of safety, and we will get there. And I think AI, when we get there, it is going to be very easy to manage some conditions remotely.
Yes.
Yeah.
Well, this conversation could go on. There's a lot to be talked about, spoken about with regard to telemedicine. It's not just about tech. It's not just about AI. It's actually about saving lives, and it's personal. So if you saw any information here that you'd love to share, well, you have to share it anyway. That's also your role in telemedicine. Follow us on all our platforms at the Med Squad Pod. That's the handle to use. And do share this episode. Do share it, especially with your skeptical friends. We'll see you next time.